morning, Chairman.
Good morning, and good morning to everybody, and welcome to the meeting of adults and community wellbeing. And I would also like to welcome the members of the public who are listening to the audio feed via the County Council's website. I'd like to just confirm the members of the committee who are present. Rachel Wilson, Democratic Services, will ask members of the committee to indicate their presence after their name is called.
Thank you. If all members can state present when I call the name. Councillor Hugo Mark.
Present.
Councillor Elizabeth Sneed.
Present.
Councillor Bob Adams.
Present.
Councillor Paula Cooper. Councillor Robert Fakes. Councillor Rob Kendrick. Councillor Julie Kelly. Councillor Mrs Christine Norton.
Present.
Councillor Mrs Marianne Overton. Councillor Christopher Reid.
Present.
And Councillor Mark Whittington.
Present.
Thank you, Chairman.
Okay, thank you. So, well, I'd first off, Councillor Patricia Bradwell will be attending later. She's just got a meeting this morning and will join us when she's got back home from her meeting. And I'd like to welcome Justin Hackney, Assistant Director and Specialist Services, who is here also on his own merits, but representing Glenn as well. So, and also while we're here, I welcome Heather Roach, who will be joining as she's chairman of the Safeguarding Board, Lincolnshire Safeguarding Board, which will be our first agenda, but I'll introduce you as we go further through. So I would just ask all members to turn off their cameras and microphone when not participating in the debate, except for voting. When we need a vote, we will continue with the practice from the last meeting, where I'll ask everyone to turn on their cameras and raise their hands. So, okay, so to start with, we'll go for apologies for absence.
Thank you, Chairman. I haven't received any apologies. I don't know if you're aware of any.
No, I'm not. And I think all I'd say, if somebody that hasn't, if anybody has missed the roll call and joins us later, if they can just let us know. Or if we spot somebody, then we can ask them.
Yeah.
I think there might be some people that might just join in a bit or having connection issues.
I'll keep a lookout, Chairman.
So, okay, thank you. Declarations of members' interest. If any members have got any interest to declare or come across an interest during the meeting, please let us know. So we'll go to the minutes of the meeting of the 1st of September. Can I have are these a true, correct record? If so, can I have a proposer and a seconder, please?
I'll propose them, Chair.
Thank you.
Please. Yeah.
I'm happy to second them, Mr. Chairman.
Okay, thank you. So we all need to turn our cameras on and raise our hands if we're all in favour.
Chairman, I'll be abstaining because I wasn't at the meeting.
Right, okay, that's fine.
Chairman, that's 5 in favour and 1 abstention.
Pardon? Sorry, I missed that.
Just confirming that that's 5 in favour and 1 abstention from Councillor Adams.
Right, okay, so so that's good. We're okay. Okay, so we'll therefore announcements by the chairman, executive or executive director. I have no announcements. Justin, have you got anything that you would like to announce, or are you all okay?
No announcements, thank you, Chair.
Okay, so all right, well, thank you. So we'll move on to item 5, Lincolnshire Safeguarding Adults Board. And for this, I welcome Heather Roach, Chairman of Lincolnshire Safeguarding Adults Board, and Justin Hackney, Assistant Director of Specialist Services, to basically take us through this agenda item. So welcome, Heather and Justin.
Thank you, Chair, and thank you for the invitation this morning to come to your scrutiny panel to bring forward our annual plan and our 3-year strategy. This has been signed off by our own executive board and will be published very shortly. I took over as the independent chair for the board in April this year, which was perfect timing, obviously, and has been quite an interesting period, although obviously prior to that I served as sort of 3 years as the deputy and also on a subgroup looking at the safeguarding adult review, so fairly decent background there, but it has been an interesting time. The LSAB, I'm sure you know, is a statutory board. It's created under the Care Act 2014 and it's got 3 requirements. So if you just pop onto the next slide for me, Simon. Thank you. So the core functions of the board really are, one, we have to produce and publish a strategy, which is setting out how we achieve our main objective, and that really is to ensure the coordination and effectiveness of safeguarding arrangements across the county, essentially keeping people safe from harm or abuse, or the risk of harm and abuse. We have to then also publish an annual plan, which shows our progress against that strategy. And the third requirement is that we should commission and conduct safeguarding adult reviews where required. So those are the 3 key points for the board. So if you just go on to the next slide, please. So our strategy, this is the 3-year strategy. I was involved with Barry Earnshaw, the previous chair, in pulling this together, and we're in the final year of a 3-year strategy, and there are 4 key areas that I'll just draw to your attention, but others that obviously run throughout the strategy. How we developed this was through a workshop. We looked at the national and local performance information, what's happening within Lincolnshire and what our key priorities ought to be. And so we came up with a number of priorities which have progressed throughout the 3 years, and some are just about to be delivered. I know you've already had a briefing around team around the adult from Justin. So under our prevention and early help priority, that's one of the key areas of work that's been going on over the last couple of years. It has been slightly impacted by the effect of COVID, there's no doubt about that, but actually we're back on track with the recruitment of 2 coordinators over the next few weeks, and once in place I'm really confident that will take that new way of working forward. We've developed a prevention strategy. That's got a range of options. It's got a tiered approach to prevent individuals from really requiring formal intervention, and that's been agreed and is looking at now being implemented as we go forward. The third part of the prevention and early help work is about working with the Children's Board and the Safer Lincolnshire Partnership and trying to develop some shared intelligence across the board so that we work more collaboratively and that we have some shared priorities. So that's ongoing. We've got a priority around community and service user engagement, and that's really about feedback for service users and carers. And probably this is the area for us to develop more. We have developed an engagement plan. We're currently mapping what all our partners have in place to link in with the public, and we're really looking to explore with people with lived experience to be able to feed back into the process. We've got a strand under quality and assurance. We've got an assurance framework which we completed last year. We're now developing it further to look at specific learning and support, to hear from all of our agencies and to gain assurance from partners about what they have in place and where they might need our support. And finally, we've got review and learning. This is around our commissioning of safeguarding adult reviews. It's really making sure that the changes that are recommended are implemented, and really that service provision changes as a result of that. And then throughout the strategy, we look at making safeguarding personal across all agencies, and we also look at the communication to the public, raising their awareness of specific issues. So that really is a very, very quick run through what our strategy is. So we're in the final year. We will be looking at some shared priorities with other boards, but also taking our own forward and developing a new strategy from 2021. So if you can just move on to the annual report. This really is, reports against the progress that we've made against that strategy. We have to set out what areas of work we've covered. It updates a little bit around some of the performance information that we've got, and also sets out any safeguarding adult reviews that we've published in the last year. Because we haven't published any SARs in the last 12 months, we focus very much on the report in the recommendations made and sort of progress against those, which have been quite significant. The report also provides some basic statistics and the overview of the concerns that are reported. Talks about our governance arrangements and our structural change. We have slightly changed in structure, and it provides some financial information. And I'd say that will be published, if it's not already online, it will be very shortly. So if you just move on to the final slide. So the kind of future focus for me is I'm extremely grateful to all the partners who've worked with me over the last few months around COVID. We've got a really good relationship and link into the LRF, and we continue to work as across the East Midlands as well. We've got some significant links across all our other chairs. I'm going to be looking more around the assurance mapping and putting in place a realistic process that we're going to develop over the next year. It's also for me about building a picture of the contextual safeguarding issues across Lincolnshire, improving where our data comes from, because at the moment we very much rely on Justin's team to provide us with the data, and actually lots of our other agencies have got some significant information that could create a bigger picture for us. And then for me it's that so what question. So what does that lead us to focus on? We've got some recent audits that we've done, particularly around the quality of referrals into safeguarding, and also around making safeguarding personal. And it's highlighted to us that there's some work to do around that. So that's going to be my focus going forward over the next few months as well. So there's a lot happening. So we bring forward to you today to ask any questions about the strategy or the annual report. But it's challenging times, but there's also quite a lot of work going on. So I'm happy to answer any questions. Justin, did you want to update any further around the adults or any other issue?
I've just noticed, Heather, that Councillor Whittington wanted to come in, I think. So I don't know if we just pause for a second, and then I will just add a couple of words if that's okay.
Yeah,
well, if you want to say anything now, Justin.
Yeah, okay.
Then I'll bring the members in.
Thanks, Chair. So, I mean, the only thing I would add to that is that, to say a big thank you to Heather in terms of taking up the chair role. Barry Earnshaw did that previously for a number of years, but Heather's really taken the bull by the horns with the agenda, and I very much enjoy working with her as chair, and I'd congratulate her for the work she's done so far. In particular, I think in terms of the work in progressing a number of sort of historical serious adult reviews that had really got stuck a little bit, and with Heather's support and tenacity, those reports are very much near signature now, and will be going out. I think the other key area that Heather and I are really committed to is the prevention agenda. Prevention is always better than cure. And linked to, we mentioned the team around the adult work, but as part of the sort of LSAB procedures, we're also revisiting the Care Act and what the duties on partners are in relation to prevention, really. And I think that's going to be really important, because there are some grey areas, I think, within the Care Act still around that need firming up in terms of local protocols and agreements. That's all I would add.
Okay, right. Well, I'll bring Mark Whittington in, please. Mark.
Hi. Thanks, Hugo. Thanks, Heather, for the report. Very interesting. I used to be on the safeguarding subgroup that LCC used to have before responsibility for reporting went back to the adults and children's screening committees respectively. So I'm very much aware, obviously, and what I was going to ask, I think Justin's already answered that, I was aware there were a number of SARs that was still sort of outstanding, and I just wanted sort of a progress update on that. But I think from what comments Justin's made of, that's already been answered, and it's good they are nearing completion. But related to this is when you said there'd been no SARs reported in this year. Now, do you think COVID's had an impact on this? Is there potentially some hidden stuff out there that maybe COVID is masking? I know there's no pattern in terms of SARS, that they happen when they happen, but just a little bit of assurance that hopefully we've got, in these difficult times, potentially we have got things, covered off with regard. But that's it. But other than that, Heather, thanks very much for the report, and I wish you well in your role as chair. Thank you.
Thank you. Chairman. Thank you. I'll probably just qualify that. It's not that SARS or concerns haven't been reported in, it's the fact we haven't published any in the last year. So just to be clear about that, we have had 2 referrals in which have not met the criteria to be safeguarding adult reviews, although there are other options and other routes for those to be taken so that learning is gained from them. So it's not that things haven't come in. I think Justin will probably want to come in around the actual concerns into safeguarding. We did see a reduction at the beginning of the lockdown. We then, towards probably May, June time, saw it start to increase again back to normal levels. There's a document by the LGA and ADAS, it's the Insight project, which reported quite recently, and it's a national project which talks about how most places have seen a significant reduction, and then it's come back to more normal levels. It's a very challenging time, obviously, because you've got closed environments, less reporting routes, but I think we haven't seen the surge that potentially we might have expected, but we certainly highlighted that risk. Justin, do you want to add to that?
Yeah, thanks, Heather. I mean, incrementally over probably the last 4 years or so, the number of safeguarding concerns that we receive in adult care has increased, but as reported along the sort of performance lines in this committee, many of the concerns that are sent in to us never progress to Section 42 inquiries either. So we are doing ongoing work with partners, really, to make sure that they do send safeguarding concerns to us when it's appropriate to do so, but also take greater ownership of some of those sort of more low-level quality concerns as partners, and that's part of their prevention responsibilities as well. I mean, during COVID, as Heather said, there was a dip in terms of referrals coming in, but they have restored back to normal levels, and it's pretty much business as usual now from a COVID perspective, really. So
Thanks, Heather. Thanks, Justin. If I may, Hugo, could I just ask one follow-up on the question? Thanks. I'm presuming that. Sorry, I'll turn my camera on. I'm presuming that in the same way that the safeguarding reports used to go to the previous subgroup, is the intention that they're going to be brought here instead? Thanks. Thank you.
I probably can't answer that one actually, because I don't know, to be honest. I know this is obviously a public forum. The reports will be published on online. It's whether you as a committee want us to bring updates around progress or how you want to manage that, really.
That's one of the questions at the end, which we will deal with, how often it wants to come. I mean, in theory, well, we used to have a subgroup, but in a sense, it became a bit unnecessary because, in effect, the board, your board, is in effect in control, and it just became another reporting mechanism. I think would be fair. So, okay, well, I've got Liz. So we'll address that at the end, Mark, on that. It could be 6 months. But I would suspect that we are going into there'll be a new council after May, and therefore I would suggest we don't necessarily have influence over that new council and what they want to do. But I suppose one of the recommendations that we as a group might think is that they should be introduced to the Adult Safeguarding Board, i.e. so in 6 months' time would be perhaps fitting for you to meet the new adult scrutiny as well. So, okay, I've got Liz.
Thanks, Hugo. Thanks.
Rob.
Thank you, Chair. Thank you. Hello, Heather. Good to meet you.
Hi.
Our page 23, I've got a question on there. I don't know if it's your page 23, but in our report packages, talking about the number of DOLS, deprivation of liberty applications, which are continuing to increase year on year. But there is no longer a backlog, so that's good. But I'm just wondering why they're increasing year on year. If you could give me some idea about that, please. Thank you.
I'm probably going to just refer that to my learned friend Justin.
Okay.
thanks, Heather. So in terms of the DOLS applications, I think partly that will be in terms of the work that we've done with providers around the necessity for DOLS referrals, etc. So working in partnership with Lincoln in particular, the Lincolnshire Care Association, we've done a lot of training within the residential sector around the requirements in relation to the deprivation of liberties agenda, but also health colleagues have done that also. I think also though it's probably very much linked to the growth in our ageing population as well. So there are links there. So there's probably not one overall reason. It's a number of reasons, but I think the two primary ones are, greater awareness in the sector of the requirement for it, but also sort of growing demand based on people's capacity, really.
Mm-hmm. Okay, thank you. So it's not a bad thing. Yeah. That's good. It's not a bad thing, is what I'm getting at.
No, it's not a bad thing because I mean, if it would have to be approved if there is a deprivation of liberty agreed. Therefore, it's better in that way. Otherwise, we could have some people being deprived of their liberties inappropriately. But it is a challenge it is a challenge to the local authority in terms of the costs of processing, etc. But we are, I think, one of only a handful of local authorities who have no backlog, and we're very proud of the work that we've done on that in terms of managing that. The liberty protection safeguards, of course, which will replace DOLS, have been delayed for a number of reasons, partly through Brexit and also through COVID, but they will come in, I think it's in April 2022 now. So we have a little bit more time to live with the DOLS legislation before we move on to the liberty protection safeguards, but we are planning for that.
All right. Thank you very much. Thanks.
Okay, thank you. Rob?
Morning, Chairman. It's just a general question for Heather, and good to meet you too. I was just wondering, and I perhaps should know the answer to this, so I apologise, but is there a sort of national forum of which you are members that you can share good practice? And no doubt other boards could learn from us here in Lincolnshire. I was just wondering as a general point. Thank you, Chairman.
Yes, thank you. We do. We have a national network of SAB chairs, which I'm a member of. In fact, we had a meeting on the 10th of September. I did a little bit of national work around the links into the LRF, because actually it's very, very different across the country. We have an excellent relationship. Even in some of the larger places, you know, the links into the LRF, the understanding how to get information, how to seek assurance isn't quite there. So I've done some work also with the Foresight Operational Review, which reports into the Cabinet Office about how we can link in with the whole LRF system. So yeah, and we fed back as the national SAB chairs into that. We share an awful lot of information. We also have an East Midlands group, and we meet bi-monthly, so we do share an awful lot of information.
Great, thank you very much. Thank you.
Okay, brilliant. Thank you. Marianne, welcome.
Thank you very much, Chairman. Thank you. Thank you for the report. I did get to hear pretty well all of it, so thanks for that. Just having a look a bit more at the homelessness, I wonder if you wouldn't mind saying a bit more about that. Clearly, a lot of services had to be suspended during COVID, but then we also had to step up our action on homelessness. And I see the budgets there, 1.6 million for us, billion, and for local authorities, and 6 million for charities. So I'm just wondering, I don't want that money to be lost, and I'm sure none of us do. I'm sure we want to make good use of it as soon as possible. The earliest we can deal with things, the better, isn't it? So I wonder if you could say a bit more about that, please.
I guess in relation to homelessness, it's an issue for LSAB around the connection with safeguarding, but actually the responsibility around the homelessness agenda sits elsewhere from us. We certainly recognise it as a potential risk. We have done through COVID. We've linked in very much with the lead, Alison Timmins, on that, around how the position is, because obviously through COVID, all homeless individuals were offered a place. There's obviously then the knock on to that is when we come out of the other side, there's potentially an issue with a different cohort of individuals becoming homeless. But as a board, I don't sit with any budget around homelessness. It sits with my understanding, sits with districts.
So it's not a big part of your work, the safeguarding for homeless people?
It is a part of our work. It's not one of our priorities at the moment. There's quite a lot of work being done nationally around homelessness. There's a big piece of work done by Michael Preston Shute in Manchester around the links with homelessness. And I am aware there's a smaller review going on in Lincoln to look at some homelessness issues, which is being supported by the board. We will certainly look at it going forward. There is a link. We don't have the finances to take it forward, but actually it is something that we do need to keep on our radar.
Thank you.
Justin, did you want to add to that?
Yeah, if you don't mind. So, I mean, it'll be one of those areas for the board to have some quality assurance activity on, Heather, won't it? But the other link in terms of that agenda is the team around the adult initiative, which we are very much working with district councils on. And really that's building on the sort of excellent work that the districts do around the vulnerable adult panels already. But we're, if you like, enhancing that in terms of, for those people with the most entrenched and complex needs, bringing a multi-agency approach to that to be able to help, in particular, those people who aren't engaging with services So that's an overlap with it. But just to reiterate what Heather says, really, the districts have got the statutory lead on homelessness, but we do have links through the Safeguarding Board.
Thank you.
Excellent. Well, I think from my point of view, I think, I mean, there is a lot of information and data in both the strategic and the annual report. 3,751 reported concerns in the year. Or is that well, that's the summary from 2019 to 2020. I mean, that's 10 a day. That's quite a phenomenal, I mean, that's actually a bit too worrying in some sense. That it's good that we are getting reports. And when you look at the fact you've got 20 partners, you've got nearly 239 ambassadors across 98 providers. I mean, they're great figures, and in fact, highlighting a bit more, of which 55% of those cases have gone forward. Often the worrying thing is the 45%. Some of those that perhaps do need help. There are some that use our systems to sort of have a swipe at each other in this. What does sound a bit alarming is why the over 65s are actually higher than under 65s. And it's not just a wee percentage, is it? I mean, it's sort of nearly, you're nearly 25% more. So what's sort of the main trigger factor going on behind that then, do we think?
Do you want me to say that, Heather?
Yeah, can do, yeah, and then I can add to it.
So in terms of the eligibility for Section 42 inquiries, as well as people being at risk of abuse and neglect, and they do have to have care and support needs. And therefore, you know, as people do get older, they are more likely to need support from agencies like adult care and from the health system. So that is related to eligibility for services like adult social care council, Marfleet, and the biggest service users are older people. So, I mean, in terms of local authorities, etc., we're not out of proportion in terms of those sort of ratios. We do exercises and make sure that there aren't any sort of spikes in particular age group or characteristics that, you know, are different in Lincolnshire to anywhere else. And certainly when we've done that, we're not at a kilter with it, really. I think the other thing is that, you know, from a contextual safeguarding point of view, a large number of our referrals are raised from within the residential and nursing sector and within hospitals as well. And that's a good thing at the end of the day, because, you know, providers are, make referrals. Their own staff will make referrals in if they've got concerns. I would say, though, that not all concerns, as you say, make it through to Section 42. Some of them are lower level quality issues. So, you know, we link into contracting as well. So in terms of the, 10 a day, that probably only, probably 5 of those will get through. And then actually after inquiry, a lot of those will be unsubstantiated anyway in terms of issues. So there is a lot of activity that goes on that isn't actually equates to a safeguarding risk really as such. A lot of it is more reporting, which some is good, and some of it is absorbing resources, which arguably, the providers should be picking up those quality issues. But the over 65 issue is it's linked to the proportion of people we support are older people.
Right. Yeah.
Can I just add to that, Chair? I think that's absolutely the case. We're not out of sync nationally. That is the picture across the UK. We do look into where the reports come from, who reports, what agencies. And as I mentioned at the beginning, the quality of referrals is important to us as well, because, sometimes you'll get an agency that refers quite a lot of concerns in, but actually they just need a bit of education because they shouldn't be referring in. It's not a safeguarding issue. And I think the other thing to say is that once they do, the concerns do come in, they're obviously scrutinised to see, what further information or whether they should go forward. And then there's feedback to those referring and signposting onto other sources of help. So I'm not worried about that. We need to use our data as a board better, which is why I'm talking about expanding the collection of data from other agencies. But it is about giving us that big picture, the contextual picture of where our issues are and where agencies should be looking, because we're a massive county. The demographics are, really, they're very different from the East Coast, obviously, to the west of the county, and of course the diversity issue within the county as well isn't lost. Yeah.
In fact, actually, just sort of linking back, I think in some sense, I agree with the over 65s. I think it's one of these, isn't it? It's very easy to become focused that safeguarding is about sort of, in some sense, domestic abuse. And actually, when you look at it, it's only about 6%. And it's often one of those that, and I think even the public, sometimes struggle to really understand the whole holistic of sort of safeguarding approach. We all sort of tend to get a bit blinkered in some arenas. My other sort of area, I suppose, is that obviously from a Lincolnshire's point of view, these systems have no boundaries, and often we are, you can be in the north and running quite close to north or northeast Lincolnshire. Do we have those? Are those sort of like the sort of safeguarding teams in the north and northeast? Do we sort of work with them a bit to sort of make sure that we are covering a potential sort of over the boundary issues on that?
Yeah, I mean, we do have contact with obviously our other chairs. We're probably more focused around the East Midlands, but also do have connections within Humberside and North East Lincolnshire. So yeah, we do keep alive to the fact that contextually it might not just be our East Coast that's got an issue, that it might well be over the border. And realistically, you find this through reviews that sometimes borders do create you a problem, but actually, just knowing the individuals within those arenas, you can pick the phone up to them and speak to them about, whatever issue it is. So we do have pretty good relationships cross-border.
Yeah.
Justin, did you want to come in?
Yeah, it was just coming back to the point that Councillor Marfleet raised around domestic abuse, and I think that is one of the cross-cutting issues for all of the strategic boards. It touches upon children's services, Safer Lincolnshire Partnership, and LSAB, really. So that's something that LSAB are keen to work with the other boards on as an agenda. I think in terms of the reporting of domestic abuse as well, it's probably underreported in some contexts, because actually some of the work that we've been doing in analysing the data within LSAB is that actually the primary sort of reason may well be a financial abuse or physical abuse or something similar to that. Actually, when you look at who the alleged perpetrator is, that's often someone who's known to the individual. And that includes sort of family members. So in some ways, if we looked at sort of who the alleged perpetrator of some of these safeguarding issues are, then it would show it a certain different picture. So that's very much what we want to move towards, really, more around sort of contextual safeguarding and looking at it from that perspective. We do lots and lots and lots of work with residential and nursing homes for our contract management, etc. To me, it's actually what we do in our communities and how we help people to be safer within their own homes. Really, that's part of the prevention work that we need to go and doing forward. With all of the boards, really.
Excellent. Okay. Well, thank you for that. We've got Councillor Patricia Bradwell has joined the meeting, and welcome. And is there anything you'd like to say, Patricia, or?
No, Mr. Chairman, I just had to go off to Laos to meet a lady who's having reablement services. So it was quite interesting to hear what she was saying. She was very happy with the service she was getting, and so was the support worker giving the service. So that's where I've just been. I know probably you think I should have been with you, but I thought it was interesting to listen. Okay,
No,
so thank you.
Good.
So I'm here now.
Excellent.
Thank you.
Welcome.
Thank you.
Okay, so basically we just need to make comments. I think we're just one thing. When is the new strategic plan in effect implemented? Is it April next year?
Yes, it is, Chair. Yeah, we'll be looking to either hold some session towards the end of this year to review and this calendar year to review and develop the next strategy, or we'll do it very early next year, but we'll have it ready to go by April 2021.
Okay, brilliant. So so in a sense, I would say that ideally I would say you want to sort of come back in the sort of start of the new council whenever adults is in, but obviously it's a key part of adults, and I think you've got a new strategic plan. I presume it'll be a 3-year plan again.
Yeah, I mean that's up for debate with the panel. Obviously, it's a partnership, and we'll agree which way forward. But whether it's a year, whether it's 3 years, we obviously review it every year and take it forward. I think I'm keen not to have a lot of priorities. I'd rather have 2 or 3 large priorities and deliver on them than try and spread ourselves too thin, and also to work very closely with Children's and the Safer Lincolnshire Partnership, so we're not going off at tangents and that we're all focusing on the same sort of cross-cutting issues.
Yeah, okay. I suppose the only question I'll therefore sort of come back with is, obviously because of this change over elections, I mean, we might be having them, might not, but we have to work on the principles that we are. Do you want to would you like to, I mean, I don't know, and I'm only just off the cuff here, in terms of when you get a draft, do you want any of us to see it before you do anything, or just, I mean, that I'll just put that one back to you, because obviously we're going to be all right. The new council, everything's completed and you're on your way, and it's whether, I suppose, we have a look at the draft before it's cemented.
Yeah, I guess, I mean, Councillor Bradwell is obviously on our executive, so has oversight of what we do. I'm more than happy to share with you a draft if that works for all of us. I don't have any strong feelings either way, to be fair. I think, do whichever is preferable. I don't know whether Councillor Bradwell's got a view on that, whether we do that or keep it to the exec.
Well, I have no issue with a draft coming, but obviously it would need to be at the final stages, I think, Heather, because obviously lots of partners will feed in, and sometimes you do have days with partners, although this year will be slightly different probably because you can't have big meetings, can you? But I think, normally it is for partners to feed in and give their view about your plan, isn't it? Yeah. And then I think perhaps before it has been, when it's nearly ready to be approved, it has perhaps come to scrutiny, or it's come after it's been approved. But I don't see a problem in it coming. But I think it does need to be in its final stages with no big changes from any partner.
Yeah, no, absolutely. Yeah, no, I think we will still have a development session, even though we can't obviously meet together. We'll do it virtually, and we'll run it that way, so we get all the feed in from all the partners, because obviously you're a partner. Obviously got the police and health as well, who are statutory partners, and so we'll get everybody together.
And I think this new arrangement of actually Heather, coming to the adults board, you will feel more that you'll feel more that you have more information on perhaps what the agencies are doing within safeguarding, whereas before it seemed to me to be a little bit at arm's length. So, you know, I think it is for us, Heather, to actually keep them in the loop about, you know, what's happening, what are you know, the issues for us for 6 months, 12 months. So I think it will be a better working relationship, and members will understand the moving issues that we have within that arena.
Yeah, definitely. Thank you. Yeah, I welcome the support. You know, I'm challenged, to be fair. It's really healthy.
Okay, thanks.
Yeah. Well, I think on that note, what we'll do is obviously the new term will plan it in accordingly. And I think it's about raising awareness because there'll be new members, etc. Simon will pick up on that one. And as for the draft, I think there'll be an element of how it all ties in with our committees and the election as well. But I think, again, we'll let Simon liaise with you over time as and when it's ready. I know we have a meeting in April, which technically is going to be within, we have to watch because we can't make decisions and things, but it might be one of those things that just ties in. But Simon, if that's okay, we'll let you and Simon liaise on that one. Are we all happy with that sort of approach? Anyone got any different ideas, or are we all happy with that, committee members?
Yes.
Okay.
Fine, here you go. Yeah, fine.
All good, thank you.
So in effect, are we sort of in an agreement with that then? Yeah. So.
Agreed.
Okay. Brilliant. We'll go with that. So, all right. Well, thank you very much, Heather. And that's been very interesting. And I think, as Patricia said, that actually the fact that it's sort of, we've altered it, and I think it will bring it closer towards adults in terms of, you know, it'd be nicer to sort of follow it and, you know, and sort of be a bit more involved rather than the subcommittee sort of that handled everything. But anyway, we're here if you ever need us, and you know where we are.
Thank you. It's nice to meet you all.
All right. Thank you.
Okay,
have a good day.
thanks.
Right.
So, Chairman, can I just highlight that Councillor Mrs Overton and Councillor Kendrick have joined the meeting during discussion of the last item, just for anyone listening.
Yeah, brilliant. Okay, so we'll go on to item 6 then, budget monitoring 2021. So have we got Pam Clipson here?
We have. Morning. Thank you, Chair.
Morning. Morning.
I'll go on to the report. Pleased to report a continued underspend forecast for the end of this financial year of 437,000 underspent across adult care, community and wellbeing, driven predominantly by income received from direct payment audits. The team that are reviewing all the direct payments have confirmed that the final 371 will be completed during 2021, and we will then see our income revert to what I would class as our new normal levels. We were also quite fortunate in a grant that we were expecting to reduce during 2021 has actually been maintained at its previous levels, and so that was additional income we weren't expecting. The only area that is forecasting a slight overspend in the report is the cost of community care packages in mental health services, but we've had an improvement programme in place since the beginning of the year, since it transferred, the financial monitoring transferred into LCC, and the early indications are that that overspend will reduce in the coming months as we put in the actions that we've agreed. The only other bit that I wish to highlight today is the COVID-19 spend on page 48. Since writing this report, the Council has received a further £8.4 million, and that's the second wave IPC monies that were announced nationally. That will be allocated 5.42 million to residential providers aligned with the grant criteria, 1.74 to community providers, again aligned, and then there's 1.79 million that LCC can allocate for other care settings that haven't received things like daycare providers, direct payment providers and IPC measures. We've been given 20 days, which takes us to the end of October, to get 80% of that payment out, and then monthly monitoring right the way through to the end of this calendar year now. So quite a busy finance environment still around COVID-19 and expected till the end of this financial year. Those were the key points I wish to highlight. I'll take any questions.
Okay, brilliant. So nice piece of work. By the way, balancing the books nicely in adults is a great reward, especially when we've done 9 years of it. It's a great achievement. Okay, I've got Councillor Chris Reid to speak. Hi, Chris, are you about?
Yeah, thank you, Chairman. Yeah, it was just a quick one. Firstly, it's impressive that we managed to stay on, broadly stay on target with the budget, considering everything going on this year and obviously the impact that will have had on adults. It was just a quick one, really, more sort of going forward, whether you expect there to be any costs implications next year that we're probably not seeing within this financial year relating to COVID next year, and if that's something that you're sort of building in going forward, or if it's something where you think actually, you know, everything's already set up to sort of mitigate any of those additional expenses anyway. But as I said, it's impressive that it's all managed to stay on target for this year.
Yeah, it's definitely a very busy world, and a great introduction for me into the world of adult care. I think for me, in terms of future costs, there are two key ones. The first is the market that our providers are working within. We were due to negotiate the next 3 years for residential provision. That was supposed to start in April. Well, it's supposed to start this year and then in April, and we've delayed it again. The main reason for that delay is the financial pressures that our providers are under, and to try and negotiate a fair and equitable 3-year deal whilst they're in such unprecedented and uncertain times wouldn't be best for either the council or providers. So what we're trying to do is work with them to maintain non-recurrent support for them financially. Any costs they're incurring as a result of COVID, whether that be staffing, PPE, whatever that might be, then they continue to come into the council and we continue to do additional payment runs for them. I don't think that will end on the 31st of March 21, so we are working with them to see what they need going forward. And the second element is the amount of additional processes that we, both within LCC and then our partners like Serco, have had to put in place. Things like the discharge to assess model from hospitals. It's causing a lot of manual work, and it is causing a bit of delay around some of our core services, but we report those, we highlight those, and we have managed to staff them with some temporary staff to help get through that workload. There may be a bit of run into 21-22, but we monitor it every month, and we're monitoring it. We'll keep it under close scrutiny, and we'll deal with that as it comes. I think the definite improvement we've got in adult care now, we know where we spend literally every penny nearly now, line by line, and adult care do a brilliant job across the ADs and the area team managers in working with their finance team to work out their business as usual finances as well as the COVID-19 impact. And to put it into a bit of context, adult care in Lincolnshire are dealing with £42 million more spend in this financial year as a result of COVID, and that just shows the work that people across adult care and the finance teams and everybody else are managing.
Excellent. Is that all right, Chris? So, okay, I've got Mark Whittington next.
Thanks, Hugo. Hi, Pam. Thanks. Hi, thanks for the report. Very encouraging. Obviously, despite all the pressures we've got this year with COVID, that we're managing to come in underspent. But I guess £500,000 on a budget of 230 is a small percentage. I've not bothered to work it out, but it's a small percentage. Yeah, I'm interested because I obviously I've had the benefits of talking with you about how your financial modelling works around this, and I know each year going forward in each of the years of the medium-term financial plan, because I had a quick peek at it from Michelle shared it with me yesterday. That obviously I've seen all the demographic cost pressures and things you've built in over the next 3 years. So I'm sort of happy that that we do identify all of this because I'm very much aware that there is very good information sharing between between the service managers and the finance teams. And it's just good because obviously I'm aware that obviously we've received for this year, the cost of COVID, we've received the 3 tranches of funding so far, and I'm pleased that we actually seem as if the money we've received is covering all of the cost pressures. It's just really positive. I've got no real questions, Pam, but just want to thank you and your team again for managing a very, very high spec. It's the biggest chunk of money, adults in the council, and obviously the impact of COVID is but I've got every confidence in you and the team. And just Mr. Chairman, I just wonder if at some point, Pam, when we do settle down, maybe you could perhaps do a little session briefing to this committee on how your financial model works. I think that'd be really, really useful, because certainly I had half an hour with you and Michelle, and you come away so full of reassurance. But that's all I have to say. Thanks, Mr. Chairman, and Pam. Thanks, and please extend my thanks to all of your team as well. Thanks a lot. Thank you.
Thank you very much. That means a lot. Thank you.
Cheers. Thank you for that, Mark. Okay, Marianne.
Thank you, Chairman. Actually, I'd like to echo those comments, and I thought your answers to the questions were very helpful. Thank you, Pam. It's excellent, very accurate and concise. So well done. You clearly got a good brain on that will help us. The question I'm after is the issue about mental health, and you talked about it going over budget a little. I think the current situation, as has been said, may be hiding an increase in cases that may be starting to appear, and this could become a bigger problem. I don't know if you've got any thoughts about whether there is any more money coming that we could put into that, or what the situation is. Thank you.
Yeah, I'll pick up the finance bit, and Justin might want to pick up from an operational perspective. But Justin and I worked really hard towards the latter part of 1920 on trying to put the mental health services financial position on the same footing that we have for learning disabilities. And basically what that means is we have an infrastructure in place which monitors every package of care. And from my perspective, that's the only way we can demonstrate value for money, that we change people's packages of care as their needs change, and that we can forecast robustly. And part of that change into 2021 was bringing the financial monitoring for mental health across into LCC to mirror that system and that process. So the forecast that was in originally was based on historic information. And we've spent the best part of this financial year working with Justin and Lorraine and his team and LPFT jointly to review all people within mental health, their packages of care across all their services, and to make sure they've got what care they need. And through that work, we've identified that actually some of the costs are no longer needed, and we can bring that down. And that's why we're forecasting now potential improvement in that position. And then I don't know, Justin, if you want to talk about operationally and what we've got planned for going forward.
Sure, thanks, Pam. So, yeah, when we look at the forward plan later in the agenda, there are certain items that are coming up on the scrutiny agenda around the mental health agenda, so we can go into quite a lot more depth in there. I mean, broadly, what's driving a lot of the demand in the LPFT Section 75 agreement that we have as a council discharges from mental health inpatient provision. And that I am personally and supported by Pam and others doing a lot of work around reviewing the joint commissioning arrangements around mental health services, and we're using our influence as a council in terms of influencing where the CCGs and the money we get from NHS England are invested. So in particular mental health crisis support. If we can help to prevent people being admitted to mental health inpatient provision, from stopping them becoming that critically unwell, then obviously that will reduce discharges as well. So that's really the focus of the work that we want to work with CCGs going forward. But as I say, we will pick up in a lot more detail on future agendas.
Thank you very much. I hope that the preventing people going into that care is because they're better. It can't be an objective in itself. The objective, of course, as you rightly point out, is about making sure people are actually not in that situation that they need it. Thank you.
Absolutely, yeah.
Excellent, thank you. Liz?
Thank you, Chair. Morning, Pam.
Morning.
I'll echo everyone else's comments. A really clear and concise report, and just about the right length, actually. It was easy to follow as well. But mine's really just a comment, Pam. You weren't in the earlier part of the meeting, but I was asking about dolls, and I'm interested to see how much dolls cost us. And it's expensive, isn't it? Well, it seems to be, but Justin has explained to us, fortunately, how this is all about it, and it's quite comforting to know. So it's really not a question, it's more of a comment, but I was pleased to see that in there. Thanks very much, and thank you, Justin. Thanks.
Thank you. Christine?
Thank you very much, Chairman. Identifying risk and forecasting robustly are very difficult. You do need a crystal ball. And my question might be for Justin. I'm interested in the risk you think is coming long term from the effects of long COVID, which we're just discovering. This is always a numbers game, as the government so robustly tell us. But I'm interested in what you think the impact on adult frailty and long-term conditions, what long COVID might have, if you could possibly have any idea what the impact might be on us. Thanks.
I mean, it very much crystal ball gazing. I mean, it'll be an impact certainly on our future health services, and there'll be all sorts of knock-on effects in terms of adult social care with that as well. But yeah, I mean, I think as in most of our sort of budget managing models, as data becomes more available, then we'll feed that into it. But it's probably too early to be fair to be able to understand that with any certainty.
This is a learning curve for everyone, isn't it? But thanks for that. That's thank you very much.
The only bit I would add on to that, in terms of the things that we're monitoring, back to Councillor Whittington's point about the MTFP, we are now monitoring occupancy rates by our care homes, because some people aren't happy to return to care homes or aren't going into care homes in the first place, which is impacting both on service users' needs in the community, but also the care home and the sustainability of those homes. And the other thing that we are regularly monitoring now is the changes in care packages for the service users through our heads of service, and they are liaising constantly now with our service users, whether that's because they used to get daycare, they need one-to-one, whatever that might be, and all of the financial impact of those feed through into our model and our forward forecasting. So yes, we do need a crystal ball, but we have altered an awful lot of the way we monitor to be as accurate as we could be going forward. But we will, without the ball, you're absolutely right, we're doing the best we can, but it's not an exact science.
Well, I hope your guesstimates continue to be as good as they are now. Thanks very much.
Thank you. So just one other item of interest. I mean, it was on Radio 4 this morning around long COVID, and that actually they've identified certain criteria that makes it more likely that someone may experience long COVID. And again, that's it's actually related to being sort of obese or female, or over 50. So they are the three sort of key characteristics that they're looking at, but both in terms of being able to develop better preventative approaches. But again, you know, in terms of future modelling, sort of information from public health, etc., might be an opportunity for us to refine our projections.
That's excellent idea. Thanks very much.
That's quite interesting, and actually, it's while you're there, Justin. One of the areas is, we know COVID has hit the elderly population. We know about the residential and nursing homes. We know about shielding. What about actually learning disabilities? Are these guys sort of, because we don't necessarily hear a lot about that. Are they sort of, do they have a sense of resilience against it, or are they as vulnerable?
So the shielding list that is the revised shielding list that is being developed in preparation of, you know, the full second wave, etc., is going to include people with Down syndrome. So they will go onto the shielded list, and we are making preparations through the LRF in terms of being able to identify those individuals through with health colleagues and through our Section 75 arrangements. So, you know, we will be putting support in as part of that shielded group. But generally for other people with learning disabilities or learning difficulties, they're not specifically identified as a high vulnerable group. But of course, we do have people with learning disabilities are over 50, and you know, some are obese as well. So all of those characteristics that present a risk to the general population will also present a risk to the people with learning disabilities as well. So, I mean, from an adult social care perspective, we risk rate all of our cases around the need for social care and our support to them in terms of the things we've put in place in COVID. So people with learning disabilities are risk managed in no different way than an older person case.
Yeah. Well, that's good. Thank you for that. And I think that at the bottom, which talks about public health and community wellbeing, and then it does mention that this excludes children's public health. Actually, I do think potentially we ought to. It would actually be quite nice, and I'll put that on our forward agenda for November when Derek comes, because actually I think it'd be quite nice to see a bit of the children's public health, because actually that has an impact on how successful that is to the impact in terms of our adults' expenditure and finances. So anything sort of coming from children's has an impact. So just worth having an eye look at that. But I think just to summarise, well done, congratulations. You know, and I think, you know, as everyone has alluded to, great job in keeping everything sort of on the ball and under very good financial controls, even in these extreme times. And so thank you and the team.
Thank you very much.
Any other comments anybody would like to make, or are we all happy with that? If we're all happy, we will then
all good, thank you.
All good.
Good.
Happy.
Chair, sorry, I'd just like to reiterate my thanks as well from a senior officer point of view to Pam and her team. Really appreciated, Pam. Good report as well. Thank you.
Thank you, Justin.
Excellent.
Congratulations. Well done.
Yeah.
Yeah, well done.
Thanks. Enjoy the rest of your day, everybody. Bye.
Thanks,
Brilliant.
Pam.
Thank you.
Thanks, Pam.
Bye. Okay, so we'll go on to item 7, digital roadmap. We've got Theo Jarrett. I've seen him about somewhere. So he's about. And to sort of take it away. Are you there, Theo?
I am here. Thank you, Chair. So what we've got is a very short report that's been provided to the committee, but also in with that report there's a presentation that's been prepared. So what I'd like to do is just take you through that presentation. Are you okay with me sharing my screen? Is that the best thing to do?
Yeah, that's fine. That's
okay, fine. So just
are you on your own?
I am, yes. So the report's been done.
Room, but into
oh,
is Emma with you, or is she?
No, I'm afraid I am a late substitute for Emma. Emma's not working today, unfortunately, so she's asked me to go through this with you. So luckily it does fall within my area of responsibility, so I should be able to talk you through effectively. So yes, can everyone see that firstly?
Yes.
Okay. Yes. All right, so so if I just go on. Okay, so I think the last time the committee had anything about the digital roadmap for adult care and community wellbeing, it was going back nearly a couple of years, and it does outline that in the report. I think at that time we were right at the start of a journey in terms of putting together something coherent that described what we wanted to do to use technology in a better way to assist people with care and support. So we're 2 years on, and obviously we've had a lot of progress during that time, a lot of transformation, but also we've had the period of the pandemic. So I think it's useful for me to cover quite a few of those items as we go through the slides. So the first slide here is really just looking at the themes, and although we're talking about digital technology, what we're effectively looking at is we're not looking at bits of hardware, bits of software and data. We're actually looking at a plan that's built around people and around what benefits people can actually gain from using technology and digital advances. So the plan's built around 3 groups of people. Firstly, digital citizen, people who use services, people who are carers, people who might be interested in care and support. So effectively what we're wanting to do there is to support people to help themselves to access the right care and to do it in the most efficient way. The second group on the slide there is our workforce, our internal workforce, care and support workforce within the council. So what we're wanting to do is we wanted to support them to do what they need to do in the most efficient, safest and best way for them. So that's been a priority for us. And then the third group of people, we've called it digital community, and it's really sweeping up everyone outside the council. It's not necessarily a service user or a carer. So it might be our providers that we work with, both commissioned and non-commissioned across Lincolnshire, might be our NHS colleagues. So we've said, right, that's our digital community. We need to make the way in which we interact with them and work with them the most cost effective and efficient that we can be. So what we're clear on with this plan is that at no point should digital solutions be the absolute only solution available to people. When we started out on this journey, we really looked at and we talked to a lot of people, including council members, but also staff and people who use services and the carers. And the message was really strong that we shouldn't go down a single route of digital and force people down that route, because some people either don't have the access because they don't want to, don't feel confident, or they're not in an area that actually has got good connections, either 4G or through the Wi-Fi. So what the plan does, it's a strategic plan that's got some operational elements that we're delivering. But what it does is it allows us to effectively plan to support the business, support social work, support providers in the most effective way, and it enables that discussion with colleagues in ICT, colleagues in Serco, and also it's been really effective having that plan in terms of bringing in external funding. So as we stand in the past 2 years, we've effectively brought in just over £750,000 into Lincolnshire to fund pilots, to fund technology projects, and to fund evaluation of those. So that's money that hasn't had to come out of Lincolnshire County Council's coffers. So it's additional money, and it's helped to really kickstart what we wanted to do in Lincolnshire and sustain it. And in effect, it's been a self-fulfilling prophecy. When we've been successful with one particular pilot or one particular piece of work, NHS Digital, the LGA, or local NHS colleagues are coming back to us to say, what can you do to sustain this, to take it further? So just moving on to, firstly, we've got a series of projects here that are being worked on at the moment. What I want to do is, I noticed there's one in particular that's been missed off there. But I'll just quickly mention that at the start of the pandemic, we knew that we wanted to ensure that all of our workforce could work remotely. So they'd all had 4G enabled computers, and obviously there's a lot of work being put in by our IT teams and Serco. Well, what we found with mobile phones, we effectively had a real mishmash of people having really old phones. I think the oldest was a 13-year-old phone that we had amongst the workforce, right up to date to the modern sort of Samsung devices that we've got. And also what we had was a real spread of costs as well. So some of the real older phones were on the highest tariffs. So we had no real visibility of that. So right at the start of the pandemic, we did a quick piece of work to get everybody to the same place with their mobile technology. So working with the Serco team, the phones team in Serco, we got over just over 400 devices out to staff across adult social care teams and some of the public health frontline workers. So that was done really quickly and just meant that they were in the best place to be able to access mobile technology. What we've got on the slides is a series of updates on where we are with each of these. So what I'll do is, if I just go through them, Chair, is that okay? And do we want to take questions at the end?
Yeah, that would be best.
Okay. All right. Okay. So if I just move on. The first slide is about something called Virtual Wallet. What we'll find as I go through these projects is that at the start of the pandemic, we really had decisions to make over what we were going to accelerate and what we were going to put on hold. And that was really to do with the prioritisation of the workforce that we have. We had some of our workforce that were deployed elsewhere, working in the emergency centre, working to support frontline workers. So as a case in point, this particular project, which is effectively sits alongside our Connect Support directory of services, but allows people to purchase services using the direct payment or using a personal health budget. So that was actually put on pause because the project manager for that project was needed elsewhere in the organisation. What we've done very recently is we've started this up again, and effectively it's a way of remotely purchasing care and support through an online facility. So it'll be offered as a choice. As the slide says, it's we started up with only 3 users. Those people were quite happy with it throughout the lockdown period. It enabled them to get the care that they needed and pay for it effectively. And we had oversight of that as well, which is really vital. If they needed more, we could give that quickly, as opposed to responding if there was a crisis. So that's something that's building up at the moment. It's just started going again, and we're looking at how we can use it effectively and roll it out to people with direct payments. So if I move on, better care and better ops. So this is something that we started with some LGA money, probably nearly 18 months ago. We got that money that came in that paid for 2 years worth, plus the development of this technology. This is something that it's an online financial assessment. So this is really something that we're seeing as a part of the solution in terms of some of the improvements that we're making with financial assessments at the moment. What happened with this? We're in a position where we were using it with some service users and social workers. Then we had some changes to the policy that went live earlier this year. And we effectively had to recalibrate the form so that it was calculating correctly. That's all been done now, and that's ready to go live in the middle of November this year. Okay, so if I just move on, Connect Support Lincolnshire. This is something I mentioned earlier. It's effectively it's a website with lists of providers, care providers, but also what it does have is those non-regulated services that people might want to use that are a bit more lower key. Coffee mornings, activities at local church hall. So there's work that goes on between the council and also Age UK, Lincoln and South Lincolnshire to keep that up to date. And it's something we've got around about 1,000 listings on there at the moment. What we're doing is we're now loading it with those services that are going to be paid for. The virtual wallet that I talked about earlier will be directed through Connect Support Lincolnshire. This is something in particular that NHS colleagues, and they've always been part of the development governance board around this, but they're increasingly looking at this as a solution for those people who have social prescriptions or who have got the ability to self-care. So looking at this as a solution, and we've got some papers going to the NHS CCG board in November to outline a case for that. What I'm really looking for is contribution from the CCG in terms of getting a hand in the pocket to come on board as an equal partner with that. What we did at the start of the pandemic as well, members will be aware of the fact that there were a lot of ad hoc volunteer groups that sprang up at that time in villages, towns and areas, good neighbour schemes. People really got going in terms of supporting people who were perhaps vulnerable or shielding. What we did as a result of a request from the emergency centre and through the community cell, we developed a page on Connect Support that actually listed those approved groups that were set up at the time. So they'll have been through the sort of checks and balances that were introduced by the emergency centre teams. And when they were approved as such, they went on to Connect Support. So effectively what we're trying to do there is reduce the amount of incoming calls that were coming through the CSC and to the Wellbeing Service. So for those who can do it and can look themselves, we signposted them to the listings on the Connect Support site, and we tried to reduce the impact of everyone having to go through that customer service centre single point of access. Okay, so there's a number of things that we're doing on there at the moment to develop and modernise the service. Okay, so I'll move on. NHS may offer care providers. I mentioned at the start the 3 groups of people that we're really focusing on in the digital roadmap. This really falls in that 3rd category, that digital community. So the council, as you'll know, has got the responsibility for market management, and what we started to do is work with our strategic partner, the Care Association Linker, to work with homes. This was probably around about last year when we started this work, is to have a look at the digital capability of our care homes and care providers throughout the county and start to work with them to bring them up to speed. And that has really been a really useful baseline for us in terms of knowing which care homes might need better support. So throughout the pandemic, the NHS has actually given free access to NHS mail, and they haven't had to go through some of the hurdles that they perhaps had to go through previously. But as of September, that has been rescinded. So in Lincolnshire, we're in a much better situation with our care providers because we've done that work with them across last year and early on in this year, getting them up to a level where the digital capability and capacity is much greater than it would have been without that work. So what we've been able to do is provide a bit of a bedrock for this piece of work. It's a funny name, Wazan. It's effectively a very simple kit that comes in a suitcase, and it allows care staff within care homes and also other residential settings to take simple measurements, and that would be pulse rates, oxygen levels, and it builds up to a picture, statistical picture of the person that they're able to then upload to a cloud-based solution. Now, what we're doing is we're working with Linker and with our NHS colleagues. The council's leading on this. I'm the SRO for the telehealth group. But we started this as a small pilot, and the NHS really wanted us to prove its worth. But as the pandemic hit, it became apparent, and members will remember back to the time when it was really apparent that care homes were obviously a really big concern for the NHS and also for the local authority in terms of their susceptibility to COVID and the vulnerable people that were living there. So what happened was we worked with the NHS and persuaded them to put additional funding into the Wazan project, which has enabled us to, we've got 178 care homes, it's actually 235 now. So we're at the point where the vast majority of care homes, regardless of the client type that they've got, but the vast majority of care homes in Lincolnshire do have this kit, and they've got that connection with their local GPs and also community health teams. So what that effectively does is it allows GPs to see remotely the state of somebody and decide whether to deploy an ambulance or whether to actually go out and do a visit. And it's really reducing that impact of people having to go in and out of care homes. What we also did as well is we've got each of the kits, as well as some technical kit, comes with a very simple Android tablet device. So it's a bit like an iPad, but it's less costly. What we did was we pre-installed something called Q Doctor and Q Health. So this is a proprietary video consultation software that Lincolnshire NHS teams use. So what they were able to do is both take the readings and also have that face-to-face discussion with care staff and with the individuals. So in terms of this particular project, this has been one that we've really accelerated throughout the pandemic to get to the stage where we're up there in terms of deployment across the county. I've spoken twice last week at regional and national events just about this experience. I think it's fair to say that other areas have got the same ideas and they've got the same needs, but they've not necessarily had that ability to get out there. And I think it's because the key thing here that was mentioned at a national event last week was that because it's been led by the local authority, we have that natural connection and contact and relationship with the care homes through our commercial teams and through our social work teams. When CCGs are trying to do this, they're almost having to build that from scratch. So that's effectively how we've been able to get ahead with this particular project. I think next on the slides, let me just see if this works. I got a feeling that it is a video. No, it's okay. What I'll do is I'll share to colleagues the video. It was something that came out earlier on in the year, and it just showed a care home manager in a care home using the equipment. It's been shared a lot of times. It's been published on the LCC site, but it's fantastic. Some of the feedback that we're getting now, both from GP surgeries and also community health staff, about the use of the kit and their trust and their view of the care sector being hugely improved through that contact and through that assurance that the kit's providing has been fantastic. So I'll share that video. It's about 2 minutes long, but it just is really, you're able to see exactly what goes on with the kit rather than me talking about it. Okay. Clinical care portal, again, this is us working with our health partners. This has been quite a long running piece of work, and we're now at the point of it's actually working. So the basis behind this is sharing of appropriate information electronically. So the idea is that our social work teams would be able to see through the care portal and through Mosaic, the system that they use, additional bits of information that tell them if that person is in hospital, what medication they're on, who's treating them GP wise, and that's live information that links to health systems, and it's vice versa as well. So they will be able to see, health workers will be able to see what care is in place for that individual, what sort of equipment they have. So it's very basic sharing of crucial information that will just really round the circle in terms of that full information when a practitioner is dealing with an individual. Facebook portals, this is something that we got on board with a national NHS body called NHSX. Decided to launch these early on in the pandemic, and it was as a result of care homes being and other residential settings being effectively cut off from the outside world, and lots of them have means of getting in touch with people, but we pushed very hard to be included in the national pilot, and we've got 35 devices that are out there being used in different locations with different client groups, and the intention is really to improve that personal interaction that an individual might have with the family or with the friends or carers who outside of that residential setting, especially if they're in a position where there's no people allowed to come in and out of the home. So the early response has been very positive for that. It's an interesting development because, as you'll tell from the title, Facebook portals, it's an off-the-shelf device. So what we can learn from this, an off-the-shelf device that anyone can buy from Amazon or just go into your local technology shop, what we're learning from this will be crucial in terms of us going further. So it doesn't, what we're saying here is that it doesn't necessarily need to be a bespoke care or health piece of technology that actually benefits people. So that is still ongoing, that piece of work, but we're starting to see some feedback coming through. House pilot, again, this is something that was started before the pandemic. We've got a small number of people who are LCC employees, and they've got caring responsibilities. I think there's just over 20, I think there's 23 people. So this kit, I don't know if you can see in the box there, but it's effectively got a small number of devices that could be placed around the home in the most appropriate place: door sensors, movement sensors, and a plug sensor. So commonly this might be put on the kettle to test out when if someone has a cup of tea at a certain time in the morning. They would the system, very simply, it would come up on the carer's mobile phone just to say, right, say if it's their dad that's been monitored, your dad, he's had his cup of tea at 7 o'clock in the morning, he's opened the fridge and he's moved, or consequently if there isn't any of that. So it gives some level of assurance in a very simple way, without being too intrusive. So that's ongoing as a piece of work. We're looking at how that can be extended into care and support, the realm of care and support as a tool at the moment. But as we stand, it's just with people with caring responsibilities who might need to do that through works time. Armed pilot, again, remote technologies. This is actually based on wearable technology. So this is something that has been on hold. We didn't start it before the pandemic, but as of this Friday, we're looking at kicking this off again. So this is really aimed at people who are at risk of falling and have certain criteria around the fact that makes them at risk. So it's a very simple wearable device similar to a Fitbit, and it would track things like pulse rate, movement, other things that are possible through that device, feed it into through the internet into a system that would again give some sort of assurance about movement, or also track what's normal and then be able to say, actually, this isn't normal, we better start having a look at this person. In other areas, late last year, some of the case studies that we've seen, so they say that we can predict falls up to 32 days in advance. We are trying it as a pilot to see if that's true, if it works in Lincolnshire, and we'll see if those claims are true before we dive in with that. And we need to make sure that people are happy with the monitoring remotely of them. So that is one to watch. And the very last slide, I believe, this is something, again, very early stages. The Care Act came in 2015, and it does give local authorities, gives them a choice as to how people can actually access assessments and reviews. So it doesn't always need to be through a face-to-face assessment. So there is that flexibility there. And this is really us sort of going down the route of maybe having an element of the assessment being done online. So there might be some initial questions, and we're linking it to the initial conversation, piece of work that members will be aware of that's happening in Lincolnshire. Just to have those initial discussions, but there might be things that people could actually look at themselves if they're guided to do it most appropriately. So it's an investigation piece of work with a number of other local authorities and with a company called Looking Local, who are supplying our Better Care online form. So the intention is that we will explore that with a view to getting a much discounted route into using that in future, if it's suitable for us, if it fits with our IT system, which it should, because there are some links with Mosaic already that Looking Local have, and also if it's right for our model of assessment and review. So I'm aware that, I think that's the last slide. I'm aware of the fact that I've banged through those and people have had to sit and listen to me, so I'm quite happy to take questions now. So if I can just stop the sharing, stop presenting. Okay.
Okay, well, we've got Councillor Mark Whittington up first.
Okay.
Mark.
Hi, thanks, Hugo. Thanks, Theo, for a very interesting presentation. There seems to be an awful lot of things going on. I've got a number of questions, but I'll go through them. I'm guessing, obviously a lot of these projects you're saying are pilot projects and stuff you're doing with other bodies. I am guessing that is the direction of travel that once you've been through the pilots and a lot of this stuff, you'll be looking to roll them out. And then I'm starting to think of questions about project plans and business cases and costs and all that sort of stuff. So could you just give a little bit of sort of background as to sort of potentially once a lot of these pilots have sort of, hopefully once they prove their benefits, what the next sort of steps are in terms of working up an entire sort of strategy, underpinned by business cases and costs, and just to give us a feel as to if you think the spend will be capital revenue or both.
Yeah.
But then a question I always ask when anybody talks about moving stuff online, as it were, potentially, I guess this, and I think you alluded to it, a lot of this will work for the 80% of people, 85% people who've got access to 4G and Wi-Fi and feel okay to use it and operate it. But obviously, with all this stuff, it's the old 80-20 rule, isn't it? I'm just wondering what we do for the 20% who, for they might live in an area where the broadband just isn't good enough. They may have issues about not feeling confident about using it. So just what we would do to help us support those, or what would the backup position be for those people who couldn't access this stuff? Thanks, Theo. Thanks.
Okay, thank you. So yes, I'll just absolutely right. I think probably about 50% of what I've just talked about is things that we're trialing, things that are pilots, and as an example, the WASAN piece of work, the telehealth equipment support for care homes, that was a pilot with. And it did have an evaluation framework around it that had to build up to the CCG. Really, what I wanted was the CCG to take that on and invest in it. So the plan was to build that up and build evidence during this year. But of course, pandemic hit, and there were some things that were mandated by government, the Department of Health, that really WASAN just hit all the boxes. And it was being taken up in such numbers and well received that they just bypassed the whole business case side. But you're right, Councillor Whittington. Roughly about half of what we're seeing here is pilots. What we've got in terms of what we're building towards is the recommissioning of our equipment and telecare contract, which I think. Should have got the date. I think it's in around about 2 years or just slightly less than 2 years. So for example, some of the pilots that I talked about, House Pilot, the Armed Pilot, Facebook portals, are all to do with either reassurance or contact. Then those, I wouldn't envisage the council investing in, if we're say investing in 35 Facebook portals, I wouldn't envisage the council then investing in 10,000. Actually, what we need to do is take the learning into the recommissioning of the telecare and equipment contract, which will takes us into more of a modern age. The other thing that's going to be an issue with that is that the disappearance of hardwired phone lines, which will be final by 2025. It seems a long time away, but actually lots of new there are no new devices being being released So we need to get used to how this type of technology works in homes. So I think with that, the pilots, where they are pilots and they're going to lead towards that specification, that's learning that we'll take into that. Where it's not, and we want to continue it as business as usual, we will need to work up a business case, and I'm thinking that is probably going to be in the online assessment. That is going to need a business case to actually take it into something that's accepted. We need to see something from it. Just in terms of the second point there, we're absolutely aware of the fact that online is not right for everybody. So so you're absolutely right. That 80-20 rule, and as time goes on, if we're talking in say 10-15 years time, that it's probably going to be 19-10 the percentage split. But what we have said from the start is that we should not actually push people down a solely digital route. We should always have a route that is say paper-based or face-to-face. So what we're effectively doing with digital is that a lot of these things are almost pushing the what's done into the realm of the individual. So if they can do it themselves, then they're able to do that. Say the online forms that we're talking about. If they're able to do that, then actually what it's doing is it's freeing up resources that are more able to spend more time with individuals who might need that support, that 20%. I think as we speak at the moment, it's probably more like sort of 60-40, but we'd want to see the proportions change. So I think our view is that digital should be there for people to choose, but it should be there as a tool to almost give time and space to the teams, the practitioners who have then got the time and the capability to deal with that 20%. Just on the last point as well, that's the issue of connectivity, either through 4G or availability of good speed Wi-Fi, and also people's digital skills is something that we're acutely aware of, and it's heightened as an issue in a county that's as rural as Lincolnshire. There are people within the council who are working on a number of fronts, sort of working with the broadband providers to ensure that spread and that coverage is right, and also there are people who work in the digital skills arena, and they're looking at working with some of the community groups like Links Digital and other voluntary groups to ensure that there's increasing digital skills. But it is something that we're aware of, and I think the answer to the previous point, the fact that if people really can't access it or they can't use it effectively, there will still be the route, and that, for example, with Connect Support, there's a phone line that people can ring and get exactly the same support as they would if they accessed it on the phone, over the computer. So we're always wanting to have that there for either people who can't or just they don't want to do.
Okay.
Yeah.
Good.
Thanks, Theo. Thank you, Ashley. Thank you.
Thank you.
Councillor Marianne Overton.
Hello there. Thank you. Probably a bit shorter, I think. Firstly, just to say with the LGA funding, I'm glad that we're getting things back for our membership. So maybe I don't know how much our membership fee, I don't know how much that was, but it does sound like a useful thing. The other point is that, all of this data, if we can get it clear, then obviously it's helpful for us making claims for funding from central government, because we can point out, the costs and this upfront cost that would make savings further on. So I think that's very helpful. The second point is on the WISN. I looked up the cost of some of the others just now, but is there a possibility, and I know you mentioned about putting it in the contracts for the new contracts, but what about private purchases? It may be something we should promote privately some of these things. Thank you.
Yes, thank you, Councillor. That's a good point. So all of the so Wazan, House, Armed, Facebook portals, a lot of these things are available off the shelf, and it doesn't necessarily need to be us that have to either provide it or through me getting money from the CCG provide it to homes. So it could be things that there is the rewriting of the residential care contract at the moment, and I've got one of my team working with Jane Hervey, who is in the Lena's team, just to make sure that that element is sort of looked at and modernised in that contract. So you're right. Just in terms of the funding that we're getting in, what we're finding now is that because we've been successful previously, is that we actually get picked out and talked to ahead of others. So as an example, because of the WASAM work, I was asked to bid in for something called virtual wards money that is more health based. So I've put the bid in. It's been successful. It's been about £220,000 that will come to Lincolnshire, and this will be around using similar kit to the WASAN, but actually in people's own homes. So it'll be linking up with home care, but also people doing it for themselves. So we're getting identified as an area that can deliver on things and get selected for funding. So it's self-perpetuating in terms of the funding coming in. And obviously you've just had the finance report from Pam. Anything that we can do to ensure that we're not taking money out of the funding for provision for services or for our social work staff is positive.
Excellent. What does just on that, CSL, 5 devices for CSL?
Yes, so sorry, that is community supported living. So
Right.
that is where people with it doesn't have to be, but it might be generally with maybe physical or learning disabilities live together in perhaps a home somewhere. So yeah, that was just to differentiate it. So when we think about the support that we're giving, the WASAN, the Facebook portals, don't think of it as just people in old age residential homes. It's across the board, and we just and that learning is important as well across the board. So CSL is just that those for younger adults with disabilities who live together.
Yeah. No, I mean, I think that's a great concept, because at the end of the day, there's many people out there that don't need a tablet, an iPad all the time. They just need periodically to go on, or else someone would spend their whole time looking for it, broken, whichever, and that is a far more effective way of utilising an assets.
Yeah.
So, okay, I've got Councillor Rob Kendrick next.
Thank you, Chairman. Fascinating presentation, and it just shows what technology can do for us. And I think it's marvellous. I'm glad that we're at the cutting edge of all this in Lincolnshire. The question I've got is around armed and wearable technology. Obviously, there's a big focus there on sort of monitoring health. But I was just wondering, bearing in mind the number of cases you have every year of people with dementia issues who go wandering and very often, sadly, come to an unhappy end, but also obviously cause a lot of stress for their carers, in so much as that there's a major police effort to find them.
Yes.
I was just wondering if any work's been done on so building into the technology, the wearable technology, any tracking for people who are prone to wandering, who are not in residential accommodation but living at home with a carer.
Yes. Yeah. So we haven't got anything active at the moment there, Councillor Kendrick, but I think you're right. Absolutely, the arm technology, which focuses on falls, but effectively, what it is, it's a GPS device.
Yeah.
And it's just, and we'll all be sat here with similar devices on our wrist. And you're absolutely right. I think obviously that there's some ethical considerations there, but we would go through the right routes. But I think that is something for us to explore. Absolutely.
Yeah, I mean, obviously there are capacity to make decision issues and things like that around that. But on a slightly lighter note, I mean, I'm struck by the fact that my daughter's cat wears one where she can track the cat, because he's notorious for travelling long distances and trying to find him.
Yeah.
And on a more serious case, obviously, I mean, there's some very distressing cases of people who have actually gone out into the countryside and not been found until an unhappy situation has arisen. So I do think there is a serious point to that as well.
Yeah.
Thank you. Thank you, Chairman.
Excellent. Councillor Liz Sneed.
Thank you, Chair. Thank you, Theo. Interesting, quite not frightening, but there's a lot to take in, isn't there? But my question is actually about WUSAN, if I've said it right. In your little write-up, you've put reduce unnecessary early admission to residential care homes, but you don't actually mention them being for use at home. But that must mean that you're using it at home before you go into a care home. Am I correct?
Yes. Yeah. So the big thrust of the WUSAN project is largely around care homes. We have had three of them deployed into more independent living, sheltered accommodation. I think one's in a CSL project. So that's perhaps quite a small area of that, but you're absolutely right. It's the majority of it is people already in care homes to provide that sort of link with medical professionals. But yes, we've got 3 that are deployed in non-residential, non-care home locations. So that's one of the targets that we've said we wanted to try and achieve with those devices. The additional funding that I've just mentioned that we got identified for, and it's come through, I think it's come through last week, those devices will be in people's own homes. So that those are specifically going to be people with long-term conditions, possibly COVID recovery is being targeted, COPD and other respiratory conditions. So people who are happy to live at home, but they need that reassurance and that connection with clinical and other care and support services. So yes, that will extend over into people in their own home.
And so potentially a caregiver could come in and help them use it.
Yes, that's correct.
That sounds good. Thanks very much. Thank you.
Excellent. And Councillor Christine Lawton.
Thank you very much. The digital transformation has been just phenomenal, as we wouldn't be sitting here on Zoom having these meetings as we wouldn't have thought a year ago. Fascinating pilots, but I am reassured that we won't be forcing people down the digital route. However, Rob raised the question of cats, and I thought about the cat cam. And then you, Theo, raised a question for me, which is really important, the ethical and philosophical question. This digital route that we can go down, the things that we can do to look after residents, to allow them to keep their independence is truly amazing. But where could it possibly end? When does keeping an eye on Granny become keeping her under surveillance? I mean, we could have cameras installed in every room, and you would make sure people were kept an eye on, literally. But philosophically and ethically, that would not be tenable. So how do we cope with that journey that we could take, but in my view, we shouldn't?
Absolutely, that's something that we'll have to consider at every avenue and have that impact I want to call it an impact assessment, but I probably don't mean that. It is. So we've got a digital group that has practitioners on board, and then we have the I can't remember the term, but it's basically the ethical use of technology we can raise with our senior colleagues such as Justin and others. And also an important check for us is that discussion with members about what, where is it where we're at in terms of our expectations and what's acceptable. So be assured that we're not straying into the territory that might be uncomfortable for us. I think we've come a long way over the last couple of years, and going further will require us to actually consider these things very carefully.
It's a serious moral question which we will have to to deal with at some time in the not too distant future, I think. Thank you very much.
Excellent, thank you. Justin, you want to come in?
Yeah, I mean, it was just in relation to that point, really. So, I mean, in terms of where people have fluctuating capacity, you would probably need a best interest decision around that in terms of use of sort of surveillance technology. I mean, if people have got capacity, then it's their choice of whether, in agreement with their family and loved ones, whether they think the technology could be helpful to them as a family group. But I think you're right. It is a fine balance to keep, but I think there should be, where people don't have the capacity to necessarily make that decision themselves, there should be a best interest decision in place to support that. Yeah,
it's a difficult one. Thank you very much.
Okay. Excellent. From my point of view, I think your themes is absolutely spot on. That's well captured. I think everybody's sort of covered most parts off, and I think this is a very exciting agenda going forward. There is definitely overlaps happening or going to happen, isn't there, between some of our existing providers of equipment, like you say, the telehealth, and these other things like the sort of the armed and the housey. In some sense, do start to overlap with other providers of systems and equipment.
Yes.
And I think that there will be a path develop on how we do shape that all going forward anyway. I think we have to push this agenda because I think right now highlights how much this is far more needed. And I think, the other elements of the NHS mail, that has been so long sought after that's just going to really help revolutionise emails going to the NHS and to care homes. And also all these sort of clinical portals. The other area is in effect on this sort of assessments. And I suppose you've got the Connect to Support Lincolnshire. I mean, that's near that one. Is that a public one then? Is that got all the information?
Absolutely. So it's used probably in equal measure by members of the public, the families, but also professionals as well. So what's available, where it is. So we get a lot of feedback from professionals because people, social workers, neighbourhood team workers, tend to have knowledge of what's going on in their area. There's a new group being set up. There's this that's available. So they're keen to use it as well as their clients and people who are outside of social care as well, who don't quite need that assessment as yet. They just need bits and pieces to keep them going, but activities, what's on in the local area. So yes, absolutely, it's public.
Right. Okay. So we might just get the link sent round to us all on some of these.
Am I okay to put it in the chat, or should I send it to Rachel?
Pop it on an email, and then I can link it and have a look through.
Absolutely.
And I think that's good. How do you pronounce that? Is it Wazan?
Right. Yes, it is Wazan. I'm not sure if I'm pronouncing it. Yeah. So it's just a brand name. I suppose they're looking for something a bit different, but it's in particular there's all manner of telehealth equipment, and some of it's very complex. Wazan is extremely simple, and care staff in particular, they talk about using it is in the same way. I don't know if anyone's ever used a defibrillator machine. The ability of the machine to just instruct you to talk through what you're doing. It's very similar with Wazan, and that's where the success has come from there. It was trialled and clinically accepted, but then it's gone on. It's been simple. It's just at exactly the right level.
And I suppose the only thing is I'd perhaps start to use the themes as these pilots and these projects get bigger. I would put them under the themes. It's much easier and clearer. Yes. The other area which I think in some sense the one thing we all talk about is we will struggle to get 100% buy-in because of the nature of what we're dealing with at times. But I think there is an element, and I don't know how far we are getting with this. For argument's sake, let's say my great aunt was struggling to access this online, or even the assessments. Have we got to the point that a relative can also log in? Because actually there are relatives out there that don't necessarily live nearby, but in effect like a customer portal, i.e. somebody that in effect can sort of oversee and make sure that everything is still all right, and it allows us to go digital, because inevitably that needs to be the direction of travel. And as much as we can allow for paper or over the phone, at some point it will always end up on digital in a database. And actually the people that perhaps can't do that might not be in the situation that they can actually access anything other than what's prescribed to them in terms of the outcomes. And actually there will be relatives that would love to, well, in effect somebody should be in there, and I know there is a safeguarding element, but in effect a power of attorney style system needs to sort of come in. And I know from a work perspective, it's sort of this sort of allowing others to see that information that are essential to the person that's receiving the package. Are we getting there with that?
Yes, and you're absolutely right. There are considerations around. You don't want anyone ringing up and saying, "Well, I'm so and so's son," or "I'm so and so's mother." So there are records kept on Mosaic as to who the representatives are, and it might be that someone manages the money or someone just lives away and helps with that, and the individual themselves can give that okay for others to access. So for example, with the financial assessment form, there is an ability to share that appropriately for a short period of time, and that is, I think it's limited to 48 hours in any one go with others. It might be family that live away. So yes, absolutely, that's something that's considered.
And that could be extended, because obviously if you've got family living away, they don't just want 48 hours, they might want to see, which is a help to you guys as well. So it can be re-extended, but it's always got to be if the person's got capacity with the agreement of the individual. So that's been built into some of the online facilities that we've got, where you've got people's personal information and details about them. But for the things that are more just, if we're just wanting to give information out there that it doesn't require, it's not any personal information, it's just about what's going on, what services are available, what should happen to you if you're having an assessment. That's all publicly available, and that's also used by friends and family who don't live with the individual. Well, it's certainly come a long way from getting that first. I think it was nearly about £10,000, wasn't it, from the pilot scheme and the very launch of this that Emma went for. So, and for what we're generating now, and the fact we're taking a lead, I think is a great achievement. And I think this will be at the forefront of going forward in so many areas. So, I think excellent work, and keep it up.
Cool.
Anybody got any other further comments? We're all happy with this. I'll take silence as yes.
Okay.
All good. So, okay. Thank you, Theo.
Thank you, Chair. Thanks, everybody.
Yeah, thank you.
Right.
Okay, so we'll go then on to the work programme. Simon.
Thank you, Chairman. If we go straight to page 60 to 61 of the agenda pack, we've got the 4 items listed for the next meeting in November. Also on page 61 are the items for the 13th of January. There's one addition, which is the annual report from the Director of Public Health. And just over the page on the 24th of February, the Boston Extra Care Housing Scheme will now be later in 2021. So that needs to be deferred in the work programme. I will also liaise on the programming of future updates, reports from the Lincolnshire Safeguarding Adults Board. Thank you, Chairman.
All right, brilliant. As on the 25th of November, Derek Ward is coming to do a COVID-19 update. Can we get a briefing note on children's public health and just some form of briefing note to come in that agenda pack? Or
certainly, Chairman, I can ask for that. I mean, I'm sure you're aware that the Children and Young People Scrutiny Committee has, I mean, strictly speaking, that committee has children's public health within its remit, rather than this committee.
Yeah, no, it's just quite nice seeing what's going on from the children's that in effect is going to come through to adults. It's only necessarily, I mean, I would like to know, I don't know about anyone else, that's why I just say as a briefing note, not as an agenda item as such.
Okay, I can certainly request that. Thank you, Chairman.
Anybody got any other comments? We're all okay with that? It's fairly quite well loaded up, and there'll be no doubt something that will come or needed to be added from either central government or from the outcomes of COVID, etc., as we go forward. So I think we need to be a bit mindful of how much more we load that all on. The only other thing for noting at this point in time is we have a committee meeting on, is it April the 10th? Lost the page now, which might get moved if we need to move it, because where are we? April the 14th. We have raised some issues about that because in effect it will be in PERDA potentially. And so if we had to move something because we needed something pressing as a pre-decision scrutiny item, then that meeting may be moved. Wasn't that what we spoke about, Simon?
Yes, that's correct, Chairman. If it wasn't suitable in terms of pre-decision scrutiny, there may be a need to move it maybe towards the middle of March, I think was the discussion. But yeah, that maybe we can come back to that when things are a bit clearer at the beginning of 2021. Thank you.
Brilliant. Okay, well, I think that all confirms the meeting. I did decide to start to call everybody councillors for a change because I was thinking, and I don't know how many people are listening on the public, but if I sort of start calling everyone by their Christian names from a public perception, they perhaps don't know then who we're talking about. And I thought it should get a bit more used to it, that people are listening via audio and they don't see the visuals. And therefore, if you are on audio, it'd be quite nice knowing who's actually speaking or who's asking the question. But any other questions? If not, thank you all.
Thanks.
Have a good day, and we will see you very soon.